Hello, I'm Steve Heward, the Public Information Officer for the Florida Department of Health in Sarasota County. Today is January 12th, and today I'm joined by Michael Drennan, our Disease Intervention Services Program Manager, to talk a little bit about the Moderna COVID vaccine and the need for the second dose. Michael, we hear a lot about the second dose and a 28-day number associated with Moderna. Can you talk about what that 28-day mark means?
Yeah, thank you, Steve. 28 days is going to be the minimum date that we want to get someone the vaccine. So after they get that first dose, we want to make sure we at least wait 28 days before they get the second dose. Now, ideally, we're going to hit it on that 28-day, but it's okay if it goes a little bit longer. Some of that will be determined by vaccine availability and changing guidelines either by the federal government or the state government. So yes, 28 days is the goal, but if we go over a little bit, that's okay. Vaccine's still going to be effective.
Excellent. So, the other thing that I hear a lot about is the efficacy of the vaccine. Can you talk a little bit about that?
Sure. So after the first dose, we're going to get that primed immune response. We're going to get efficacy of about 90%. After that 28 days, we get someone the second dose, and that efficacy is going to jump to about 95%, which is phenomenal. It's an excellent immune response.
Well, that's great. Now, I believe that there's one other thing that people need to be advised in with the second dose, and that's if you got the Pfizer or you got the Moderna. Can you talk about that?
Yes, it's very important that whatever vaccine you got first is the same vaccine you get the second time. So there's two currently approved vaccine. One is by Pfizer and one is by Moderna. If you get the Pfizer vaccine first, you want to make sure you get the second dose from Pfizer. And if you get the Moderna, you want to make sure Moderna is the one you get the second time around.
Okay, and then just to clarify, here in Sarasota County, we've only received the Moderna vaccine. Is that correct?
That is correct.
Okay.
But if people leave, we want to make sure they know if they go someplace else, they don't inadvertently get the wrong vaccine.
Right, that's very important for the second doses, and especially if people travel, they will need to make sure that they're getting a second dose of Moderna. Michael, thank you very much for that, and thank you for being with me today. So, along with the line with the second doses, I want the community to know that we are planning the second dose vaccination clinics. We haven't quite hit the 28-day mark for anybody that we've vaccinated in Sarasota County. We will not be using our 2200 Ringling location to provide the second dose, and that's why we have canceled all those follow-up appointments for people that got vaccines last week and the week before. Please look at our website, sarasotahealth.org, for follow-up information as to when you can expect to see that vaccination clinic, that drive-through vaccination clinic in our communities. And with that, thank you for watching.